coming to the next video in Developmental Disturbances of Tongue. So in this video we will be discussing about Benign Migratory Glossitis or commonly known as Geographic Tongue. So as with any other pathologies, what we do first is, we try to understand the meaning of the pathology from the name. So first here we will try to understand what is the term Benign Migratory Glossitis. So benign means something which has no malignant potentially. So it is not malignant, it is benign. Next, migratory. So the lesion has the tendency to change in appearance and change in location from one place to another. So the lesion keeps on changing the location. Migratory means moving from one place to another. Next, glossitis. Itis is inflammation. Glossitis is mean inflammation of the tongue. So what we understand from this name is there is inflammation of the tongue and this lesion can move from one point to another, can move from one location to another, and it is benign. So this is the idea which we get from the name Benign Migratory Glossitis. And this Benign Migratory Glossitis is known as, it is a psoriasiform mucositis of the dorsum of the tongue. So we will try to understand more from this term. So first, when we see the term shows it is of the dorsum of the tongue. So the lesion is happening in the dorsum of the tongue. So as I have already said, this is the tongue. The upper surface is the dorsal surface, that is the dorsum of the tongue. The one which is lower is the ventral surface. So here your geographic tongue is in the dorsal surface of the tongue. Next, mucositis. There is inflammation of mucosa. Again you can see itis, inflammation. Next, psoriasiform. Psoriasiform here shows that the lesion is resembling to the lesion which we see in psoriasis of skin. So if you see psoriasis of skin, the lesion will be a erythematous area which will be covered by silvery white or silvery whitish greyish plaque which will have some scale. It will be having some scaly appearance. In some cases, even these lesions can have ulceration also. So, your geographic tongue is also going to be having a same appearance as the psoriasis of skin. So, these are the things which you can understand from the term psoriasiform mucositis of the dorsum of tongue. Next, we will see about etiology. What is the cause of this? Here, most of the time, it is unknown. We cannot say which is the exact cause. However, it has been found, the studies have shown that in patients who have high psychological stress, who are under more stress, and also patients who already have psoriasis of skin, have higher chances of having geographic tongue. So, stress and psoriasis of skin can be a reason for your geographic tongue. Next, coming to the clinical features. So, when you see the tongue clinically, actually this area, so as I have shown here, this area will be a depapillated, it will be a smooth depapillated area. There will be no papilla. So, it will be somewhat reddish depapillated area, and this depapillated area will be surrounded by a white line. These lines will be white lines, and I have mentioned it is a serpiginous white line. What is serpiginous? Serpiginous means snaky or something which is wavy. It is snake-like. So there is a wavy white line which will be surrounding the depapillated mucosa. Now this geographic tongue is also told by some people as wandering rash of the tongue, because of the constantly keeps on changing its appearance. This pattern keeps on changing its appearance and they may also change the location. Because of this, some people have called it as wandering rash of tongue. Now, why is it called as geographic tongue is, the lesion, when you see in the tongue, you can see like, it will be like some groups, you can see like, this is almost resembling to the subcontinents which we see in the globe. That's why it is called as geographic tongue. Because in geography, what we study mostly is something related to earth, something related to globe, everything. So, since the outline somewhat matches to the outline of the globe, they call it as geographic tongue. Most of the time, more than benign migratory glossitis, it is said to be geographic tongue. Now coming to the histology. So histologically, when you take biopsy, you have to include the white borders. This white serpiginous line should be included in your biopsy to see the correct histologic features. For a pathologist to correctly find the lesion, the white lines are very important. So finally, when you see the histology, you can see there will be a thickened layer of keratin. So there is increased keratin production which we can see. Next, there will be many inflammatory cells infiltration. And these neutrophils are also high in number and they can form groups, they form abscesses, and which we say it as Monro's abscesses. And the rete ridges are thin and elongated. They are thin and elongated. If the rete ridges are not thin and elongated, then the pathologist should suspect whether it is Reiter's syndrome. Actually, Reiter's syndrome consists of urethritis, arthritis and conjunctivitis. So with that, we can finally come to a diagnosis. But if pathologically, if your rete ridges are not thin and elongated, then this will be your next suspicious disease. Now, when you go for periodic acid skip stain or silver stain, periodic acid skip is PAS staining, then we can see there is growth of candidal hyphae or candidal spores in the epithelium. In the superficial layer of epithelium, we can see the candidal growth. Now coming to treatment. So there is actually no specific treatment which we have for this. But in cases where most of the time your geographic tongue is asymptomatic, it will not show any symptom. But in some cases when it is combined with fissured tongue, it may show some burning sensations, etc. So in that cases, we can provide some treatment, or if there is any candidal growth, we can provide antifungal. We can provide any antifungal medications for the candidiasis. Next, for the symptoms, we can provide topical prednisolone. For any burning sensations or any lesions with symptoms, we can provide topical prednisolone. And also there has been cases where there are symptoms, they have been provided with broad spectrum and antibiotics like tetracycline. So this is all about benign migratory glossitis or geographic tongue. I hope you have understood this concept. See you again with another topic in another video. Thank you.